Hi, everybody. I'm Dr. Bill Curry. I'm a general internist here at UAB. I'm a past president of the Medical Association, and I'm the governor for the American College of Physicians Alabama chapter right now. We have as our guest today Dr. Marjorie Lee White, who's a professor of pediatrics in the emergency department there over at Children's, and she also is a vice president for simulation for our health system. And Marjorie Lee runs our simulation centers. We'll get to her in just a moment. I just want to set up our topic, which is personal protective equipment. I think every doctor in Alabama and in the world really by this time, and certainly every hospital and institution understands the importance of it and is alarmed by the scarcity of it and trying to figure out how we're going to manage that. So that's our topic. That's what we're going to talk about. Marjorie Lee, welcome. Thank you for joining.
Thank you. I appreciate the opportunity to talk about something that is incredibly important for all of us as caregivers.
Well, our medical association wanted to get this out so any doctor anywhere, but certainly here in Alabama, could get some core information. We've had one on what the disease itself is like with Mike Sag talking about his symptoms and about treatment. We've had drive-through testing, which you and I are involved with here at UAB with Jordan DeMoss. Now we're talking about PPE. So walk us through, Marjorie Lee, the essentials of PPE. Before I do that, I do want to remind people that you have a bona fides, you have a criteria that none of the rest of us can claim, which is you trained for and trained other people for the Ebola epidemic. And so you know what really serious PPE use and infection control is and prevention is all about. So you're our biggest authority here about that. But walk us through the essentials of personal protection as a healthcare worker.
Sure. So yes, we're definitely taking lessons that we learned from Ebola and applying them in this COVID-19 era. And I would say that first, I think the most important thing is to think first about routine precautions. So before we even get to COVID-19 contact and droplet precautions, which we call respiratory enhanced precautions, I want us to think first about routine. And remember, that's surveying the scene, stopping, thinking about protecting yourself first. And so that's first that. But then the other part about routine precautions is truly that great hand washing, really with soap and water, really with 20 seconds. I think the world has gotten very creative about finding ways to remind us of what 20 seconds takes. Right. There are tons of songs that we can sing and other things that we can do, and just remembering the backs of your hands. We in fact did some simulations with hand washing, and we found using GlowGerm that the highest places where people didn't wash their hands were really at their fingernails. And I want to remind everybody, please remove your jewelry, remove things that would break your gloves. I know that for many that is a challenge, but really think about that routine precaution and minimizing, the impact. So I'd start there, right? Start with hand washing, start with great situational awareness, looking around, checking, trying to anticipate situations where we'd be. Bill, would you agree that that's kind of the first place we need to start with?
I have my own little song or poetry that I do, but it's I actually have a prayer that I do that everybody needs their 20 seconds.
Right.
And it's amazing how different that is from our usual quick deal. And the situational awareness, a great point.
Absolutely important. So that's the first level. And then I thought we would then talk about a little bit of the social distancing and the idea of wearing a cloth mask, because that's been something that's just recently come out from the CDC, right? So I have an example of a cloth mask that a friend sewed for me and brought to me. This cloth mask is, not official PPE, but the idea is that it would protect me in situations where me or any of our citizens, in situations where we may be just a little too close, right? We can't do the 6 feet where if I were to cough.
The grocery store, yeah.
Those essential places that we need to go in order to support our families. And so, wearing this cloth mask and then washing this cloth mask, right? So washing it in a regular wash machine, but in the highest water setting is the current recommendation. Obviously, I should have started with the saying all of these recommendations are changing. When we were initially putting together the guidance for UAB's PPE, I think we changed every day multiple times. We had 19 versions of the PPE checklist. So so please look to another source to document a change. But wearing a cloth mask, there's now a recommendation that we do this, and that we recommend to our patients that they do this, to primarily targeted at prevention of asymptomatic spread, right? So someone who's not showing symptoms, but who might cough or sneeze, and that then protects the people who are around them.
And always not touching the front of any of these masks.
Yeah, so that's another really important basic concept. The idea being that the front of all of your PPE, we'll talk about a face shield, is your dirty part. And that the idea is that the strings, which will be around your ears, would be clean. And so putting this on, you'd want to have clean hands, and you want to only touch our strings. And then taking it off, absolutely, you got to have hand gel. And if you're using hand gel, we use at times 2 minutes. But really the idea is your hands need to be completely dry after using hand gel. So before I'm then doing anything with my hand gel after hand gel. So hand gel, same idea, getting it everywhere, all over my hands. But then I'm only touching the area with clean hands. I would only be touching the elastic part of my mask behind my ears, for both placing which is called donning, and then placing it behind my ears, which would be called doffing. And every time I'm removing a piece of equipment, a piece of whatever it is, I want to lean forward and just exactly as you're doing, reach behind my ears and follow it so that I've got it pretty well and coming all the way off. And often, if it's something I'm removing, I drop it directly in the trash if I can. If it's something I'm going to clean, I make sure that I'm thinking about the surface that I'm placing it down on, because I'm going to need to disinfect that surface as well in terms of thinking about that.
What about other kinds of masks, like our surgical masks, and
yeah,
the different grades of those?
Yeah, we have a couple of different options for additional masks. So officially, contact and droplet transmission requires that we, or suggests, and this is where our challenges are, suggestions are that we wear more of a procedural or surgical mask. A couple of things about that. The fit for this mask and for the N95s, as many of you all are aware, is really important. And so with clean hands, if it's my first time touching this mask, I do again want to put behind my ear. But most of these masks have metal or some sort of harder piece that I want to make sure is well sealed at the nose, so that it's not floppy. I have seen some folks who are starting to have PPE skin related issues, and there are some 3D printed devices that if you're starting to have irritation behind your ears, that I've seen people doing, that allows to make this mask tighter in the back. So there's a couple of things that are happening related to that. But really, every time you make a change, try to think about the unintended consequences of the change you're making. You're using something different. That's something else to clean, something else to remove, that sort of thing. So I can see with your mask that you've done a really good job of getting the nose. I'm going to get some hand gel because I just touched my face, right? So I want to make sure that—
how many times a day we do that.
Yeah, so I am trying to be very tuned to that and have that available to me. I've used my iPhone watch, which I don't wear anymore, but I still have the hour alarm on it to remind myself to either get up and wash my hands, or to use hand gel at least every hour to minimize just what's going on in my exposure. So procedural mask, also both a barrier for me not to transmit, but a higher level. So let's talk about washing these, or what do we do about these? How do we minimize the um, the impact? I've not seen any recommendations for outright washing. Have you, Bill?
No, I have not.
No. Um, I have seen some recommendations, and then people are working through UV light and that sort of thing. But as of right now, I don't have definitive advice for the reuse of.
But you could put it in a brown paper bag to reuse.
Right.
If you,
yes, that is our recommendation. That's the recommendation now, is that you put it in brown paper, not plastic. The idea being that we don't want to grow mold and other things in a plastic bag.
Right.
And we are, recommending long-term use. So trying to use this and leave it on for as long as you're able to, within a time period. And then when you doff it, put it in a brown paper bag, and then keep it for reuse.
What about the good old blue surgical mask?
So I would think about those two interchangeably in terms of the process. Again, the difference is also the fit with the good old blue cone surgical mask. Also trying to make sure that you've got the nose piece cinched down as well as you can. You can also do a little bit more of a fit check. So you can put your hands around the edges of the mask and take some deep breaths in and out, and you ought to feel the mask collapse in a little bit if it's a good fit. If not, adjust a little bit on your face in terms of the process. You should not be reusing if the plastic straps are starting to fray or if the connections are not good.
Got it.
All right. So you're demonstrating excellent doffing procedure, right? Reaching back behind your head with clean hands, leaning forward to do that. So always carefully doing that. Do you want to stop and say one additional thing about doffing? Often you're taking off your PPE when you're tired or hot or at the end of something that you're doing. And so it's the time when you may make mistakes. And so we often recommend, if at all possible, to have a doffing expert or an observer or someone watching you, coaching you, remembering to tell you, hey, remember, reach back. Don't just grab it. Remember, the front of you is dirty. And so if it's possible, even if it's somebody, looking at you from outside a room, if it's somebody who's just can be there to help get you through that when you're doing it. Recognizing, maybe, you don't want to have somebody in with you, but if they could just give you a little pep talk, something like that beforehand in terms of your staffing.
Maybe one of the most valuable items in the world right now is an N95 mask. Yes. So what's the difference in the protection I'm going to get with this compared to these other two masks or the cloth mask?
Yeah, so my understanding of N95 technology is that there are several additional layers that have hydrostatic pressure set up to protect you from it, and the use now is recommended for any possible aerosolizing procedures. So those include if you're giving an albuterol treatment with particles being aerosolized into the air, intubation, bronchoscopy, that sort of thing. UAB is also deploying a strategy of wearing these for increased protection where people may have additional exposures. So the N95 takes it up a notch. And is an important additional layer of protection when you're going for aerosolized procedures.
What about reuse, and what about reuse of these? What's the best way to do that?
Yeah, so there are right now several strategies, many strategies being bandied around on the internet. The one that I have seen, if it is possible, is a 4-day rotation of N95. So literally writing 1, 2, 3, and 4 because of the known virus persistence on surfaces, that by the end of the third day, that the virus does not persist on the N95. There are additional strategies being deployed in larger institutions related to UV light, related to hydrogen peroxide, and those are being vetted. There are protocols on the CDC website related to that if there are questions with that.
Right. We're getting, yeah, go ahead.
I would just say that if you haven't been fit tested for an N95, the most important thing you can do is what's called a fit check, which is make sure that the mask you are using, and if you'll put yours on, the one you're using before you go in a room, you can do what's called a fit check, where you check your, I don't have my mask on because you won't be able to hear me, but you check to make sure that you got your seal at your nose and kind of all around the edge. And then you do the similar thing I was having you do with the surgical mask. Try to take a deep breath in, and you should feel a little micro collapse of your mask. And then when you blow back out, it should open back up. That's a good fit check. That if you haven't been officially fit tested, you can know that. This
one was fit tested for me, and there was something unpleasant to smell that told me whether it fit. And
right.
So, that's a great. I'm appreciative for that, but thanks for that. We're getting a little low on time, so let me ask you. Tell me if I'm doing this okay.
Right.
I should have leaned forward. Sorry.
Yep.
What about the other parts of PPE? We've got the masks, we've got gowns and gloves. What's all of that?
So the last piece that you'll hear people talking about is a face shield or goggles. Those can be used interchangeably, and we are so similarly recommending that that you think about the front as dirty. Everyone, as best I can tell, is wiping the front of the shield and reusing these. Again, same idea with doffing. I reach back behind, I lean forward, and I go forward with my face shield. We generally wipe it down once before taking it off, and then wipe again and put back in a brown paper bag to
right. And the face shield is going to be for people who are going to have particular risk of aerosolization, like your swabbers over on our testing site, where we know people may cough or sneeze and aerosolize the virus. You need a face shield for that, and obviously procedures like bronchoscopy, intubation, others of that sort. Would you need it ordinarily if you're taking care of an active COVID patient who's and you're otherwise you've got an N95 and you've got gown and gloves? Would you need a face shield then if you're going to be close to the patient?
The current recommendation is to do that for respiratory enhanced precautions.
Right, but if you're across the room,
if you're 6 feet away,
not necessary.
Then it is not currently a requirement.
Any other
my
thoughts?
Understanding.
Any other thoughts, just in general, about PPE and managing our scarce supply right now?
I think it's one of the biggest challenges of our professional lives right now, to be able to balance our personal and professional safety and those of our team. And so I think really thinking hard about who do we need to be in the room, what can we do differently, who truly needs to have the PPE, and what can we do for the patient. So minimizing family members being present, which is a really hard balance. So
what can we do virtually, over the phone, over the computer, or perhaps from the door? And as Marjorie Lee said, that's a big challenge of our professional career. And in fact, this whole pandemic may very well be the biggest challenge for the professional career of all of us. It's going to take all of us to get through it. We're right now we're in toward the end of the first week of April in Alabama. We're anticipating an increase. We'll wait and see. But even if you're in a place where there's not a lot right now, we're beginning to see even smaller counties increase. And so it's going to take everybody, all hands on deck, for us to get through this together in the best fashion we can for our patients and our communities. So Marjorie Lee, thank you for your time and your amazing expertise and for making this available to all the doctors of Alabama and anywhere else who get a chance to watch it. So thanks a lot.
Well,
thanks for joining.
We're all in this together. Thank you so much for the opportunity.
You bet.